Hello everyone and welcome again. So continuing our discussion about clinical pharmacology basic principles class, and after we talked about the drug administration, now we are going to talk about the drug absorption, which is the first pharmacokinetic process, and it is defined as transportation of the drug from the site of administration to the systemic circulation. So drug absorption is transportation of the drug from site of administration and into the systemic circulation. And the drug absorption applies to all the drugs, to all the routes of administration, except the drugs that are administered in the IV route. So drugs administered by intravenous route skips the absorption and go directly into the distribution, because those drugs are injected directly into the systemic circulation. And in this video, we will talk about the mechanisms of drug absorption, the factors affecting drug absorption, the lipid solubility of drug, pKa, clinical significance of the pKa, and first pass metabolism and bioavailability. So let's start. So let's start by talking about the mechanisms of drug absorption. And the drugs to be transported from the site of administration to the systemic circulation is by four mechanisms. And the first one is the passive diffusion, and this is the most common one. So the passive diffusion is when drugs move from the higher concentration into the lower concentration. Lipid soluble drugs would move easily and cross easily. So lipid soluble drugs cross easily. That's because the plasma membrane is lipid, and when the drug comes and the drug is also a lipid, it would cross easily through the membrane. Water soluble drugs don't cross. So water soluble drugs can't cross unless there is aqueous channels or pores. So unless there is aqueous channels or pores, because when the water soluble drug comes to the lipid membrane, it can't cross the lipid, and it would need special channels or pores to be so it would cross. After the passive diffusion, we have the facilitated diffusion. The facilitated diffusion is mediated by transmembrane carrier proteins. It's a special type of transmembrane carrier proteins, and those does not require or don't require energy. So facilitated diffusion don't require ATP, and it could be saturated. So could be saturated in comparison to the passive diffusion. The passive diffusion can't be saturated, but the facilitated diffusion, it could be saturated. And the facilitated diffusion also could be inhibited by substances that compete with the carrier protein. So could be inhibited by substances that compete with carrier protein. The third process is the active transport. The active transport also requires a special type of transmembrane carrier proteins, and those carrier proteins does require energy, so does require ATP energy in comparison with the facilitated transport or facilitated diffusion. It would not need energy, while the active transport, it would require energy. And it can move the drug against their concentration. So it can move drugs against concentrations, meaning they can move the drug from the lower concentration and into the higher concentration. And this type of transport is also saturable, the same as with the facilitated diffusion, and also it is selective, meaning there is a specific substances that can be actively transported in comparison with the simple diffusion. It would work on all substances. The final mechanism is the endocytosis, and that involves engulfment of the drug by the cell membrane. So basically the cell membrane would engulf the drug and it would take it into the cell. So engulfment of drug by cell membrane. And this type of mechanism is used for exceptionally large drug. So exceptionally large drug molecules. Exceptionally large drug molecules could be transported by this process. So now let's talk about the factors that are affecting the drug absorption. And we have two types of factors affecting drug absorption: factors related to the drug itself and factors related to the absorbing surface. So with the factors that are related to the drug itself, we have the molecular weight. The lower the molecular weight of the drug, the better absorption of the drug. And drugs that have molecular weight higher than 500 have poor absorption. So the lower molecular weight, the better. We also have the drug dose. The higher the drug dose will give us the better absorption. And drug formulations, like the extended release formulations, would lead to slow absorption because the formulation would have a lot of layers that would dissolve slowly, and it would lead to slow absorption. So example would be the extended release formulation, would give us slower absorption compared to the immediate release. Local effects of the drug, like adrenaline, when used topically, it would lead to vasoconstriction and it would lead to less absorption of the adrenaline. So adrenaline topically, it would lead to vasoconstriction and it would lead to less absorption. Also, we have the drug combinations. Like there is two drugs that one of them increase the absorption of the other one, like when we use the vitamin C with the iron. The iron need to be in the ferrous state to be absorbed into the body, and the vitamin C would help the iron stay in the ferrous state, so it would give us better absorption of the iron. And we have the lipid solubility of the drug, which the higher the lipid solubility, it would give us the better absorption. And we have the pKa and drug ionization, which in neutral drugs would lead to the best absorption. And we will talk about the lipid solubility of the drug and the pKa separately in the next slides. Now we talk about the factors that are affecting the absorbing surface, and those include the route of administration. There are some routes that have higher absorbing than the other routes. In the routes of administration, we have the fastest route is the IV route, and then the intramuscular route, and then we have the subcutaneous route and the inhalational route. And the slowest route is the oral route. So slowest route is oral route. The second factor we have regarding the absorbing surface is the blood flow to the absorbing surface, and that the higher the blood flows to the absorbing surface, the better absorption. The third factor is the total surface area available for absorption. So total surface area available for absorption, the higher the total area available for absorption, the better absorption. And example would be the intestine. It has 1,000 the absorbing surface of the stomach, and that's why the drugs are more absorbed in the intestine than in the stomach. So the total surface area, the higher the absorbing area, the better absorption we have. The fourth factor is the contact time with the absorbing surface, and that's the higher the contact time, the better absorption. An example for that would be in severe diarrhea, the contact time with the intestine would be very low, and that would give us a low absorption. While in constipation, on the other hand, the contact time would be very high, and that would give us the highest absorption. And the fifth factor is the presence of a cofactor, and example for that, a cofactor that help the absorption. An example for that, we have the apoferritin system in the stomach that help. So apoferritin system helps the absorption of the iron, increase the absorption of iron. So now let's talk about the lipid solubility of the drug, which is considered one of the factors that are related to the drug and that are affecting the drug absorption. And to understand the lipid solubility of the drug, we have the general rules. First one is that the cell membrane is a phospholipid. So the cell membrane is a lipid, and the drug that crosses the membrane must be a lipid soluble. So If the drug is lipid soluble, it would cross the cell membrane easily because lipid would dissolve in lipid and it would cross easily. But if the drug is water soluble, then it can't pass unless there is aqueous channels or pores that help the drug to pass. And also, we have one factor is that the drug is either lipid soluble or water soluble. The other factor is that the drug is neutral charge or charged. So if the drug is neutral charge, it can pass easily through the membrane, through the lipid membrane because it would be lipid soluble. But if the drug gets charged, ionized, becomes polar, and it's going to attract water molecules around it, so it basically becomes water soluble, and it would lead to the drug can't cross. So if the drug is lipid soluble, it can cross. If the drug is water soluble, then it can't cross. If the drug is neutral charge, then it can cross. If the drug is charged, then the drug can't cross. And drugs to have charge, it depends on the pH of the medium that the drug is put in. And if we have acidic drug that put in basic medium, this leads to drug getting charged and can't cross barriers. So if we bring acidic drug and put it in basic medium, the acidic drug would have charge and it can't cross. The same goes if we bring a basic drug and we put it in acidic medium, the basic drug would also get charged and can't cross the barriers. But if we bring a basic drug and we put it in basic medium, the drug would be neutral charge and which would pass. And if we bring acidic drug and we put it in acidic medium, the drug will have neutral charge and it would also pass. And most drugs are either weak acids or weak bases. Now let's talk about the pKa. So the pKa is the pH, is simply the pH at which half of the drug is ionized and not absorbed, and the other half is not ionized but it is absorbed. So one half would have a charge and it would not cross the barriers, so it would not be absorbed, and the other half would have a neutral charge and it would be absorbed. Example for that is the aspirin. The pKa of the aspirin is 3.5, meaning if we put the aspirin in pH of 3.5, so if we put the aspirin in pH equal to 3.5, this leads to 50% of the aspirin is ionized and not absorbed, and the other 50 is not ionized and absorbed. And from the pKa of the aspirin, it has a 3.5 pKa. So it has the aspirin is an acidic drug because it has the pKa of the aspirin is less than 7. It means it is acidic drug, and it be absorbed best when it is put in acidic environment, because the aspirin would be neutral charge in the acidic environment, and it would have a charge if we put it in basic environment, according to what we said in the previous slide. So if the patient took the aspirin, we have the pH of the stomach. So the aspirin would go first through the stomach and then into the intestine. The pH of the stomach is equals 1.5, and the pH of intestine would equal 8.5. So the pH of the stomach is more acidic, and the aspirin is also acidic, so it would be best absorbed in the stomach pH, but when it comes to the intestine, it would get charged and it would not be absorbed. So it would not be absorbed in the stomach. Another example is that we have another drug that has a pH of 7.5. So it is a basic drug. The basic drug, when it comes to the pH of the stomach and it is acidic pH, it will be charged and it would not be absorbed. But when it comes to the intestine, it would be absorbed because it has also a basic pH and it would have a neutral charge in the intestine, and this leads to the basic drug being absorbed better in the intestine. And the question will come in the form of this drug has this pKa, so where would it be best absorbed? So if it has a basic pKa, it will be absorbed in the intestine. If it has an acidic pKa, it will be absorbed better in the stomach. Now let's talk about the clinical significance of the pKa, meaning when the pKa is beneficial clinically. And that's to know the site of better absorption of the drug. As we talked earlier, is that the drug with acidic pKa would be better absorbed in the stomach, and the drug with basic pKa would be best absorbed in the intestine. And also the pKa will help us in treatment of drug toxicity, and that's by alkalinization or acidification of urine. So if there is toxicity with basic drug, so toxicity with basic drug, it could be treated by acidification of urine and acidification of urine, and toxicity with acidic drug could be treated by alkalinization of urine and that's because when the basic drug is filtered here through the kidney glomerulus, it would pass through into the Bowman capsule and into the proximal convoluted tubules. And if the urine, so we have here basic drug, so basic drug, and if it comes here and find that the urine is highly acidic, we made the urine is highly acidic, this would make the drug become charged and it would not be able to be reabsorbed again. So the so the basic drug, when it comes to the acidic urine, it cannot be absorbed again because it will become charged and it will be excreted, and this would lead to the relieving of the toxicity. And the opposite is true with the acidic drug. If we make the urine is highly basic, the acidic drug would be trapped and it would can't be absorbed again, and it would be excreted easily with the urine. And alkalinization and acidification of urine is done by using effervescence. So alkalinization and acidification of urine is done by effervescence. We also have, regarding the clinical significance of the pKa, is ion trapping of aspirin inside the stomach epithelial cells. So as we learned earlier, is that the pKa of the aspirin is equal to 3.5. That makes it acidic, so it is best absorbed in the stomach. So best absorbed in stomach, So the aspirin would be absorbed into the stomach epithelial cell. So here we have a stomach epithelial cell. The stomach epithelial cell has pH of 7.4, which is equal to the normal body pH. And when the aspirin is acidic and it comes inside the stomach epithelial cell, the aspirin gets charged. So charged aspirin, and it would get trapped here. So the aspirin would become trapped because it is charged, and the charged drug can't cross the barrier until there is chemical processes helping the drug becoming neutral, and it would diffuse slowly into the systemic circulation. So it would diffuse slowly into the systemic circulation, and that's what we call the ion trapping of the aspirin inside the stomach epithelial cells. And the aspirin trapped in the stomach cells will lead to a bad effect on the stomach cell, and would lead to death of some of them. And with the chronic use, it might lead to peptic ulcer. And that's also true to other NSAIDs, and that's what makes them have bad effect on the stomach. Also, in the clinical significance of the pKa, we have the ion trapping of drugs in the breast milk. The breast milk has pH of 7, which is relatively acidic compared with the pH of plasma. So plasma pH is equal to 7.4. So it is the breast milk is relatively acidic compared with the plasma pH. And when the lactating woman take a basic drug, this would lead to the basic drug getting trapped inside the breast milk because it gets charged because the pH is acidic, and it would lead to the drug coming out with the milk, and it would lead to bad effect on the baby depending on the type of the drug. Now let's talk about the first pass metabolism. So first pass metabolism is the metabolism of drugs that occur outside of administration or before reaching the systemic circulation. And in comparison with the metabolism that occur after the reaching the systemic circulation is the main metabolism. So before reaching the systemic circulation, the metabolism that occur to drugs is called the first pass metabolism. After reaching the systemic circulation, it is called the main metabolism. And examples for the first pass metabolism, we have the oral administration of drug would be absorbed into the intestine and into the portal circulation and into the liver, and where it undergoes first pass metabolism. And also another example would be the lungs after inhalation, and the skin after topical administration. And parenteral administration of drugs doesn't undergo first pass metabolism. Also, the orally administered drugs, as we mentioned earlier, they are metabolized in the liver, first pass metabolism in the liver, and it is either doesn't metabolize the drug, partially metabolize the drug, or metabolize all of the drug. So if it doesn't metabolize all of the drug, it gives it all to systemic circulation. An example would be the atenolol, which is a beta blocker. Or it is either partially metabolize the drug, like the morphine, which is an opioid painkiller, and it metabolized all of the drug, like the lidocaine, which is a local anesthetic. If the liver metabolize all of the drug, like the lidocaine here, once absorbed by intestine, then oral administration is not good. So we would not use the lidocaine orally because it would not be beneficial. And it is better to find another route like nitroglycerin, which is used sublingual. And if liver partially metabolizes the drug, then increasing the drug dose might be a viable solution. That's with the morphine, we can increase the oral dose and that we would get the same effect that we get with the intravenous dose. Finally, let's talk about the bioavailability. And after the drug gets absorbed, it reaches the systemic circulation where it goes to its site of action. And the bioavailability is the fraction of the drug that reaches the systemic circulation after passing absorption and first pass metabolism. So it is basically the dose of the drug that reaches the systemic circulation. An example, if you give 100 milligrams of a specific drug and only 40 milligrams reaches systemic circulation, this means the bioavailability of that drug is 0.4 or 40%. And that's why dividing the part that reaches the systemic circulation on the dose you give. So 40 over 100, we get 0.4, which is the bioavailability of this drug in the example. Bioavailability of intravenous drugs, intravenously administered drugs, is 100% since they are injected directly to the systemic circulation. So they don't undergo absorption, they don't undergo first pass metabolism, they are injected directly into the systemic circulation, so they would have 100% bioavailability. And the oral dose of a medication is not the same as IV dose because that's why doses are different for different routes. Oral dose is more than the IV dose just to count for the part that's not absorbed and the part that is first pass metabolized. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like and subscribe. And if you want to support us more, you can by subscribing to the Patreon. And with that, thank you for watching and see you in the next videos. Peace.